Anyway, I'm here with Debbie Caramagno. She's a acupuncturist, Chinese
herbologist,
and a nutritionist.
Licensed nutritionist. Yep.
So I just wanted to sit down today and talk a little bit about what your program's involved, what kind of clients you see, how things work. I'm particularly curious about acupuncture.
I see more acupuncture patients than nutritional patients. I've been doing acupuncture. This is my 12th year of practice, and acupuncture is based on this theory of vital energy, commonly called qi. I don't know if you're familiar with that.
I'm vaguely familiar. I know the concept.
Okay, so one thing I like to remind people is this is a medical system that's been around for 2,000 or 3,000 years. In the West, we kind of think our way of medicine is the way to go. And this is an ancient system, and it looks at imbalances of the qi, and what we try to do is help your body to heal itself to bring the qi back into balance. First, everybody wants to know, usually they ask me, does it hurt?
Yes. Okay, that's a great question.
Okay. The needles are very fine. They're only the size of a strand of hair. So, yes, occasionally they do pinch, but most of the time they do not hurt. Okay. It is not like when you go to a doctor, I'm not drawing blood, I'm not giving anybody medication, we're just trying to bring your body back into balance. So, most of the time, like I said, that people are the number one surprise that people have when they get off the table is they have this nice sense of well-being.
Just feel peaceful.
Feel peaceful and relaxed, and how can that be when someone puts needles in you? So most of the time I say it does not hurt.
So how would you say look at the qi? How would you know there was an imbalance there?
Okay, how I would know is for my first visit, when someone comes to visit me, I spend an hour and a half with them. In the first half hour, we just sit down and go over their history, and I'll ask specific questions from an Eastern perspective. Because we're always trying to balance that qi. Are you hot or cold? Are you this? Are you that? What kind of foods do you like? Where's your pain? Does it refer pain? Does it travel? And by putting those answers together, we come up with a protocol of imbalances according to an Eastern perspective. A yang deficiency, you might say, a yin deficiency, qi stagnation, blood stagnation, and then I will decide how I'm going to treat the patient.
So there's kind of a protocol set up based on
the response, and it's not only just on the questions and the responses I get. We do a lot with vision area. Looking at a patient, I look at their eyes. I look at the tongue as an assessment tool. In Chinese medicine, we look at the tongue, we look at the color of the tongue, we look at if it's puffy, we look for teeth marks, and that will tell us information about the imbalance of vital energy. And we take the pulse. The pulse in Eastern medicine is a little bit different. You take the pulse in 3 positions on the right hand and on the left hand. We're not looking so much for the rate of the pulse, we're looking for the feel of the pulse. And that will tell us
a clue as to how things are flowing.
That's right, how things are flowing, and different positions on the pulses connect to different organ systems.
So what kind of things would typically someone come to you for acupuncture for?
Well, then, without a doubt, the number one reason people seek an acupuncture is usually for pain conditions.
Okay.
So we start neck pain, shoulder pain, especially with people that work jobs where they're sitting on a computer all day. That helps a lot.
Sure.
As people tend to get older, the neck area, cervical discs get a little thinner, and that causes a lot of arthritic conditions and pain. So neck and shoulder, low back pain is a very common reason that people seek out acupuncturist. Sciatica, so knee pain. A lot of golfers come for different reasons.
Sure, they're always twisting themselves.
They have shoulder pain, elbow pain, knee pain, low back pain. Yeah, so in this community, there's a lot of golfers. So we see a lot of golfers. And I treat children fairly regularly, from digestive problems to strengthening their immune system to emotional issues. So
that's great.
Yeah, and it's wonderful to see kids because their vital qi, as when we're born, our vital qi is very strong, and as we age, yours is better than mine. Mine is better than, it slows down over time. So when children get treated, they only need to be needled sometimes for 5 minutes, and they snap back really well. So it's pretty rewarding most of the time. Acupuncture is unique in the area because people seek it out for pain conditions, but it really helps balance the emotions. And so a lot of people find that beneficial. They come to see me for back pain, and they get off the table and they have this wonderful sense of well-being when we move that vital energy, and we can make it balanced. It affects the whole body. It's not just the physical aspect, but the emotional aspect of it too. And
Sure, that
this
makes a lot of sense.
this day of
Yeah.
stress, most people, I do emotional points that we say emotional balancing points on most patients because
Yeah.
we need it.
Yeah,
Most of us.
everybody can use it.
That's right. We're all stressed out.
Like, how often do they see you? Is it, what's
Mm-hmm.
what's the protocol in terms of visits and
Well,
things like that?
Every patient is different. I try to say at least come once a week for a month, and then we'll reevaluate and
Yeah.
go from there. If someone's in severe pain, a better choice that they could do would be to come twice a week for at least the first 2 weeks or so, and then reevaluate from there. And if at the end of a month, if someone has a chronic condition, of course, it doesn't go away overnight, but if at the end of a month we start to see improvement, then we usually continue the treatments. Most of the time, if no one's had no change at all in a month, they're not as likely that they're going to improve. Every now and then, some people continue on after that, even without a change in a month, and
they see changes
they
down
still
the road.
see changes down the road.
Or things that you could share with our audience that, somebody watching this on their computer at home that might try a pressure point or a particular philosophy or supplement that you would think is a good overall help, or something that might...
I don't think I could say that, I am all about education, so when patients come to see me, I might show them points to do on their hands. Like there's one point here on the, we call it hugu, and it's kind of like the mountain of the thumb, and it's often can be massaged for headaches.
Right.
Okay,
I think I've
so
heard that before.
that's right. And there's another point on the medial aspect of the wrist, about an inch or two up from the wrist, that's very good for nauseousness. So
I've actually seen wristbands.
that's
and
right.
stuff.
This is based on when sailors get nauseous or something, their wristbands are put on this point. So I oftentimes try to teach my patients things they can do at home, like
to kind
this.
of resolve that
But to
situation.
just say there's one thing, that's the thing about Chinese medicine. They have a saying, same disease, different treatments, same disease. In other words, they look at the imbalance and they treat you individually. They don't care if Western medicine calls it 5 different things.
Right.
We're going to treat you for the way the imbalance is from the way we look at it.
Right. Now, tell me, you also do the herbology and the nutrition.
That's correct.
Tell me how that kind of plays a role in an appointment process, or what you might see with a particular client.
Well, as far as the Eastern herbology, it goes hand in hand with Chinese medicine, because a lot of times when I look at an imbalance in someone, if I can, as an adjunctive therapy, recommend some herbs that might help, for example, as an anti-inflammatory to help with the pain if someone's coming to see me for pain conditions. If someone else is coming to see me because they're fatigued and weak and their energy is low, I might recommend some herbal formulas that would be what we'd say tonic herbs. So for a woman, there's some formulas that work very well for PMS issues right before the menstrual cycle. So once I sit down and talk to them and decide where their imbalances are, then I will decide what herbal formula, if they're open to it. Not everybody is, and some people don't feel comfortable, so it's not necessary. So, and as far as the diet goes, no matter what, when people come to see me, diet is pretty important for your overall health.
Right.
So I also, if someone just wants to come see me for nutritional counseling, they can make a separate appointment and we'll sit down and we'll look over their diet. I'll have them keep a food diary before they come to see me. I'll sit down with them, go over breakfast, lunch, dinner choices, make suggestions. Probably the number one reason people would seek out a nutritionist this day and age is weight management and onset type 2 diabetes, which is epidemic in this country. So some people just see me for acupuncture, some people see me for nutrition, and some people blend the both together. So.